Hey everyone, I'm Pratik, and in this video we're going to be looking at an example of a scenario relating to clinical governance so that you can use this in order to prepare for your dental core training interview. If you're interested in more educational videos and help regarding interviews and applications, then please make sure you subscribe to the channel. So let's get straight into it. In this video we're going to be looking at the following scenario. You're about to extract the upper right first molar on a patient. You apply the forceps and begin to mobilise the tooth. Suddenly, the patient screams in pain and forces your hand away. They are now visibly upset and demand to have another dentist extract the tooth. How would you manage this situation? That's the scenario that we're going to be dealing with in this video, and it could be thought of as a clinical communication scenario, and so if you want to practice it in that sense, then feel free to do so. But in this video, I'm going to be looking at it as though it's a clinical governance station. If you've not looked back at my previous videos on how to answer some of these stations, please make sure you do that. But for clinical governance stations, I like to break down the station into three parts. So first, we look at the standards and the clinical governance factors that are affected by the scenario, and we want to list these to the examiners. We then look at the short-term management, and then we look at the long-term management. So we'll look at this scenario, and let's look at these three parts. So first, we look at the standards, the GDC standards that are affected, and the clinical governance factors that are affected as well. So virtually in every station, we're going to be considering the first standard, which is putting the patient's best interests first. The patient has come to harm potentially, they're upset with what's happened, and we need to work in their best interests and make sure they are treated with dignity and with respect. We then have standard 2, communicating effectively with the patient. Clearly there's been some sort of miscommunication, maybe they didn't understand what the procedure was, maybe something else has happened, so we need to ensure that we communicate effectively with the patient, particularly if this leads on to further things that I'm going to discuss later in the video regarding complaints. We want to make sure that we speak to the patient effectively. We also need to consider GDC Standard 3, which is obtaining valid consent. Now, the patient may have given consent for us to initially start the procedure. However, they've clearly asked us to stop, and we need to respect this. Patients can withdraw consent at any point during the treatment. We then have GDC Standard 5, which is complaints, and having a clear and effective complaints procedure. In this situation, the patient is clearly upset, and so they may want to raise a complaint. So it's important that we're aware of the complaints procedure and we can direct them to this. So we need to consider Standard 7 as well, which is maintaining, developing and working within our professional skills and knowledge, i.e. are we working within our competency? So we need to evaluate ourselves and reflect on our own practice following this situation to ensure that we were doing what we could and what we should have been doing in that situation. And when we consider other aspects, for example under clinical governance, if we consider the 7 pillars, we may want to look at auditing our complications regarding extractions and other factors within the practice. Additionally, other aspects that we may need to consider are referrals, because this patient clearly may want to see another dentist, and so we need to consider referring them to a colleague. Now, if you remember, and if you've looked at the other videos discussing these types of stations, by going and mentioning these standards right at the start of your answer, you're ticking off a lot of the buzzwords that the examiners will be looking for, and so hopefully you've already bagged a lot of the marks. Let's now move on to the short-term management and how we're going to manage this patient. The first thing we want to do is stop and apologise to the patient. Apologise that you've caused them some pain, if it is pain, and ensure that they are okay with what is happening. Just because we're apologising to a patient doesn't necessarily mean that we're saying something has gone wrong, but it may diffuse the situation very easily. The next thing is that we want to listen to how the patient's feeling. We want to listen to their concerns because this makes them feel more involved in the process. If you were to just jump in and say, no, you're not experiencing any pain, that's not a very good way to manage the situation. It would also increase your risk of getting complaints. Following this, we want to try and reassure the patient as best as possible. It may be that the patient is just struggling to distinguish between pain and pressure, which is a very common thing amongst patients. So we need to talk to them about this and hopefully elicit whether they are experiencing pain or pressure. If it's pressure, we then need to try and reassure them as best as possible. If it's pain, we then need to reassure them that we can give them more local anaesthetic to reduce this sensation. Then following from this initial discussion, one of two outcomes is going to happen. Either the patient is going to be reassured and they're going to let you carry on with the extraction, in which case we carry on and we resolve the situation for the patient. The other potential outcome is that the patient still isn't happy and they're not reassured by what you've discussed them, in which case we then need to look at the other options. So when we're doing this situation and this scenario, we're discussing it as though we're a DCT or potentially even an FD. So our next port of call may be that we call in our supervisor for some help. The supervisor may be able to provide a second opinion to the patient, and then this may resolve the situation. The patient may allow the supervisor to take the tooth out, or alternatively may allow you to continue. This may also again diffuse a potential situation with regards to any complaint. If the patient's still refusing at this point, they may state that they want to get another clinician to do the treatment for them, in which case we need to arrange for the patient to be referred to a colleague. We need to explain this to the patient, and ideally we need to inform the colleague as well who will be seeing the patient so that they're aware of the situation. Other things that you may want to refer to at this point of the conversation is the patient requiring some form of anxiety management? So do we actually need to refer them for sedation or other forms of anxiety management? Again, this pulls your other knowledge into answering this station. Then we need to ensure that the patient is stable before we send them home. So if there's any remedial basic treatment we can do, whether it's giving antibiotics, whether it's dressing the tooth, anything like that, that the patient will give consent for us to do, then we need to ensure that we are providing this for the patient so that they don't go home and end up in pain. If whilst the patient is leaving, they are adamant that they want to complain, then we need to refer them to the complaints procedure within the practice. There should be a protocol within the practice in order to carry this out, or if we're in a hospital setting, the hospital will have a complaints policy that should be followed. Ideally, any complaint should be resolved in-house at a local level before escalating it any further. Then standard things that you can say for any scenario relating to these types of situations are that you would also potentially call your indemnity provider, because they may give you some further information on how to manage the situation and maybe even just reassure you as to whether you've done everything that you could in that situation. And also you need to focus on record keeping, so having clear, contemporaneous and concise notes regarding the situation. So everything has been documented properly. If you need it countersigned by another professional, so for example if your supervisor came in for the appointment or if your nurse was present, then do this as well. So make sure everything is completely airtight in case we need to go back and look at notes. So that covers the short-term management for the patient. So there are lots of little points there that cover short-term management, and some of them are applicable to any situation. For example, calling your supervisor, recording notes, and also calling your indemnity provider. Now we move on to the long-term management, and the long-term management mainly focuses on two things in any situation. It is looking at making sure that the patient is taken care of in the long term, but also you're learning from the situation in the long term. The first aspect of managing the patient is to ensure that they have received their long-term care. So a colleague has seen the patient in order to carry out treatment, and this has been followed up effectively. Also, any complaints that the patient has put forward need to adequately be followed. So we need to ensure that responses have been given in a timely manner, whether it's from yourself, the supervisor, or the practice manager, and that the patient is happy with this. Additionally, you may then also want to speak to your supervisor about the situation. You want to learn from what's happened and see what you could have done differently. Your supervisor may be able to provide you with further knowledge and experience in the situation. You also then want to reflect and document this in your portfolio. So again, any scenario you want to be reflecting on it. What happened in the situation? What did you do well? What could have gone better? And what are you going to do in the future in order to improve from this situation? We may also want to discuss this in team meetings. So other topics that were covered in this, for example, is the complaints procedure robust? Is everyone aware of how the complaints procedure works? What could have gone differently? And was there anything within the practice that we could have done differently? For individual development, you may want to look at further CPD. So is there further learning that you need to do regarding extraction of teeth? Was your local anesthetic not effective? Was your technique not effective? In which case you then need to carry out targeted CPD in order to develop this. Finally, you may want to audit your level of complications following extraction. So if you are thinking maybe your technique isn't what it should be, you can then audit this and look at what your complication rates are and maybe compare it to complication rates of other colleagues within the practice. And then from this audit, you should be able to identify other areas that you could potentially improve. So there we've looked at the standards and the clinical governance pillars that are affected by the situation, the short-term management, and also the long-term management. And this gives us a very holistic view of the situation, and hopefully by answering it in this way, you'll cover most of the marks. If you do remember anything towards the end, make sure you just go back and fill it in, because you aren't going to be penalised for this. But use your time as completely as you can. If you found this video useful, please make sure you like, comment and subscribe. Or if there are any other videos that you'd like for me to do, then please leave a comment or contact me on one of the social media handles. My recommendation in this video is the Resin Bonded Bridge course carried out by Jazz Gulati. This is a completely online course that came up during the COVID-19 pandemic, and it's a very comprehensive course if you are considering doing resin bonded bridges in practice. I'll put all the details in the description, along with any other helpful links from this video. So again, I hope you found this useful, and good luck with any applications that you're doing. Until the next video, take care.